Imagine this. You reach that familiar peak, the moment of release, warmth, and satisfaction. Your body trembles, your heart races, everything feels exactly as it should. But afterward, when you look down, there's nothing. No fluid, no visible release, just silence. For a few seconds, you're confused. Then the questions start racing in. What just happened? Is something wrong with me? Did my body change overnight? And the truth is, for many men, this moment feels deeply unsettling. It's not something we talk about. It's not something you learn about in your 30s or 40s. But as we get older, it happens more often than most people realize. I'm Dr. Emma Blake, urology and men's health expert. And today, we're going to talk openly about something called dry ejaculation. When you still feel the pleasure of climax, but no semen comes out. I want you to hear this clearly. This does not mean you've lost your virility, your masculinity, or your ability to enjoy intimacy. In the vast majority of cases, it's a signal, not a failure. It's your body's way of saying, something has changed, and most of the time, it has a clear explanation and a solution. So let's break the silence around this topic, because I've met so many men who've gone through this and kept it hidden out of embarrassment or fear. I've seen the toll it takes, the worry, the self-doubt, the distance that starts to build in relationships. For many men, semen has always been a symbol, something visible that represents manhood, power, and health. When that symbol suddenly disappears, it can feel like a piece of your identity went with it. You might even start to wonder, am I still the same man? But your worth, your strength, and your masculinity are not measured in drops of fluid. They are measured in presence, confidence, and how you show up in your life and relationships. So let's understand what's actually happening. An orgasm and an ejaculation are not the same thing. They usually happen together, which is why most men think of them as one event. But in reality, they're controlled by two different systems in the body. An orgasm is a neurological experience. It's the wave of pleasure, the release of tension, the feeling of satisfaction that happens in your brain and nervous system. Ejaculation, on the other hand, is mechanical. It's a physical process that involves your testicles, prostate, and the small glands that produce semen. You can think of it like an orchestra. Your testicles produce sperm, the main melody. Your seminal vesicles add volume and rhythm. Most of the fluid comes from them. Your prostate adds another layer, providing protection and texture to the semen. And finally, your pelvic muscles act like percussion. They contract rhythmically to propel everything forward. When it all works together, you get both the music and the sound, the orgasm you feel and the ejaculation you see. A dry orgasm simply means that one part of that orchestra isn't playing at full volume. The pleasure is still there, but the fluid either isn't being produced or it's going in a different direction. So why does this happen? The most common reason is something called retrograde ejaculation. It means the semen goes backward into the bladder instead of outward through the urethra. Think of it like a small valve at the base of your bladder. Normally, that valve closes tightly during orgasm to send semen forward. But if the valve stays partially open, which can happen after prostate surgery, with certain medications, or from nerve changes with age, the semen follows the path of least resistance and moves backward into the bladder. You'll still feel the full orgasm because your brain and nerves are firing normally, but the fluid takes the wrong path. It's harmless and usually noticed only because you don't see semen afterward. Another possible cause is a blockage, a small physical obstruction in the tiny ducts that carry fluid from the glands. This can happen from scarring after an infection, previous surgery, or even small stones that develop in the ducts. Sometimes it's hormonal. As testosterone levels drop with age, what we call andropause. The glands simply produce less fluid. The orgasm still feels normal, but there's less volume or none at all. And in some men, it's related to long-standing diabetes or high blood pressure. These conditions can damage the nerves and blood vessels that control ejaculation. In short, there are several explanations. And none of them mean that your body has failed. They just mean that it's time to take a closer look. Now, there are a few situations where you should always talk to your doctor right away. If the change is sudden and unexplained, one day everything's normal, and the next day it's gone. If you ever experience pain, burning, or blood in your urine or semen, if you notice weakness, numbness, or any new loss of bladder control, or if you have a fever, chills, or pelvic pain. Those symptoms need to be checked out quickly to rule out infection, inflammation, or other serious causes. But for most men, the next step is simple. Get an evaluation. A urologist can run a few easy tests: a urine test after orgasm, a quick ultrasound of the prostate and seminal vesicles, and some basic hormone labs. Once we know what's happening, treatment can be tailored specifically to you. If medication is the cause, we can adjust it. If it's a weak muscle, we can strengthen it. If it's a blockage, there are simple procedures that can clear it. And if it's hormonal, testosterone replacement, when done carefully under supervision, can restore balance and improve function. Beyond that, focus on the basics that keep your body in balance. Keep diabetes and blood pressure under control. Exercise regularly, especially pelvic floor exercises. Eat whole, nutrient-dense foods that support your prostate and circulation. And get enough sleep, because hormones repair and regulate overnight. Finally, talk to your partner. Silence and shame are what cause the most damage, not the physical change itself. When you share what's going on, it creates understanding instead of distance. I've seen many men regain their confidence, not just because of a medical fix, but because they stopped hiding. When you stop carrying this quietly, you open the door to real connection and healing. Your body is still capable. Your desire is still alive. Your masculinity hasn't gone anywhere. And before we finish, a quick note. If you want to naturally support erections, testosterone, and prostate health, I've listed 4 powerful supplements I personally recommend for my patients in the pinned comment below. You deserve to enjoy intimacy at every age. And if something changes, don't let it define you. Let it guide you toward understanding your body better. I'm Dr. Emma Blake. Take care of your health, stay curious, and never be afraid to talk about what truly matters.